Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pregnancy. Introduction. Whether you are pregnant or are planning to get pregnant, you will want to give your baby a healthy start. Your body will change as your baby grows during the 9 months of your pregnancy. You will need to have regular visits with your healthcare provider to make sure you and your baby stay healthy. This program will help you understand pregnancy. It covers the female reproductive anatomy, what to expect, signs of pregnancy, prenatal care, and information about high-risk pregnancy. Female reproductive system. In order to understand pregnancy, it is important to know about the female reproductive organs. They are located in the pelvis, between the urinary bladder and the rectum. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. When an ovary releases an egg, the egg goes down the fallopian tube to the uterus. It may become fertilized along the way. If a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to expand a lot. The cervix is the lowest, narrower part of the uterus. It is a passageway that connects the uterus to the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. During pregnancy, the cervix is tightly closed to help keep the baby inside the uterus. During childbirth, the cervix opens to allow the baby to pass through the vagina. Pregnancy. Pregnancy lasts about 40 weeks, counting from the first day of your last normal period. The weeks are grouped into 3 trimesters. The first trimester is the first 12 weeks of pregnancy. Your body undergoes many changes during this time. Some changes you may experience include cravings and distaste for certain foods, extreme tiredness, mood swings, tender swollen breasts, upset stomach with or without throwing up. The second trimester is from week 13 to week 28 of the pregnancy. Most women find the second trimester easier than the first. Your abdomen will expand as your baby grows. Toward the end of this trimester, you will feel your baby begin to move. The third trimester is from week 29 to week 40 of the pregnancy. As your baby gets bigger, it may put more pressure on your organs. You may find breathing difficult and have to go to the bathroom more often. During pregnancy, the baby is in a special fluid called amniotic fluid. The baby and the amniotic fluid are in a bag called the amniotic sac inside the uterus. The baby gets nutrition from the placenta. The placenta is an organ between the amniotic sac and the uterus. It grows with the baby during pregnancy. The mother's blood delivers oxygen and nutrients to the baby's blood through the placenta. The mother's blood also removes waste from the baby's blood through the placenta. The baby's blood travels to the placenta through the umbilical cord. The mother's blood does not go into the baby's body. When it is almost time for the baby to come out, its head drops into the mother's pelvis. This causes the mother's belly to look slightly smaller. This is called lightening.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Signs of pregnancy. The clearest sign of pregnancy is that your menstrual period stops. However, there may be another medical condition causing missed periods. Some women may also experience morning sickness. Morning sickness is nausea or vomiting that usually happens during the first trimester of pregnancy. Another common symptom of pregnancy is craving certain foods. Some women may also develop distaste for some foods while pregnant. Other symptoms of pregnancy include frequent urination, headaches, mood swings, sore breasts or nipples, tiredness. If you are experiencing the symptoms of pregnancy, make an appointment with your healthcare provider. Tests. A pregnancy test is the best way to determine if you are pregnant. Pregnancy tests can be done at home or by a healthcare provider. Home pregnancy test kits are available over the counter. These kits are considered highly accurate. A healthcare provider can confirm a pregnancy. He or she can also provide information on how to care for yourself and your unborn baby during pregnancy. Prenatal care. A healthcare provider can give you information on prenatal care. Prenatal care is the care a woman gets during pregnancy. Prenatal care includes health care, along with education and counseling about how to handle a pregnancy. Prenatal care can help keep you and your baby healthy. Your healthcare provider will schedule you for many checkups over the course of your pregnancy. Don't miss any. They are all important. Most experts suggest that you see your healthcare provider about once each month during your first 6 months of pregnancy, every 2 weeks during the 7th and 8th month of pregnancy, weekly in the 9th month of pregnancy. Healthcare providers can spot health problems early when they see the mother regularly. This allows healthcare providers to treat any problems early. Early treatment can cure many problems and prevent others. Healthcare providers can also talk to pregnant women about steps they can take to give their unborn babies a healthy start to life. Babies of mothers who don't get prenatal care are 3 times more likely to have a low birth weight. These babies are also 5 times more likely to die than those born to mothers who do get care. High-risk pregnancy. All pregnancies involve a certain degree of risk to both mother and baby. However, certain factors can place the mother and baby at higher risk for problems. Risk factors for a high-risk pregnancy can include being overweight or underweight, certain pre-existing health conditions, having had problems in previous pregnancies, being pregnant at age 16 or younger or 35 or older. Health problems can also develop during a pregnancy that may make it high risk. Such problems may happen even in a woman who was previously healthy. Some of these health problems include gestational diabetes and preeclampsia. Women with high-risk pregnancies may need care from specialists or a team of healthcare providers to help promote healthy pregnancy and birth. You will probably have more scheduled prenatal visits with your healthcare provider if your pregnancy is a high-risk pregnancy.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Pregnancy lasts about 40 weeks, counting from the first day of your last normal period. The weeks are grouped into 3 trimesters. Your body will change as your baby grows during the 9 months of your pregnancy. You will need to have regular visits with your healthcare provider to make sure you and your baby stay healthy. The clearest sign of pregnancy is that your menstrual period stops. However, there may be another medical condition causing missed periods. A pregnancy test is the best way to determine if you are pregnant. Pregnancy tests can be done at home or by a healthcare provider. A healthcare provider can also give you information on prenatal care. Prenatal care is the care a woman gets during pregnancy. Prenatal care can help keep you and your baby healthy. All pregnancies involve a certain degree of risk to both mother and baby, but by keeping your prenatal appointments and following the advice of your healthcare provider, you can help keep you and your baby healthy.
Thank you for using Explain.